Today, inshallah, this is the first session in the course preparing for July 2019 exam. The exam, inshallah, will be on the 2nd of July. So we have a good time for preparation. So please, if you are preparing for July exam, you have to use well these coming few months to prepare well for the exam. Sometimes I am asked, these 5 remaining months, they are not enough. I want to tell you something. If I told you that you have 3 years to have the exam, all of us will play during the first 2 years or the first 2 years and a half, and we will start to prepare also during the last 5 or 6 months before the exam. So if you are preparing for the exam, you can start to study hard from now. Time is good if we use it well. And always we know that in times when we have no time, we do our best. The MRCOG Part 2 exam is not very difficult for the one who will prepare for it well. So just I want you to prepare yourself to feel proud of yourself while you are going to the exam that you did good preparation. To pass or fail, it's not your work, it's not your business, it's a gift from Allah. We are just doing our best. And I want to say for doctors, they pass in the exam before. Trust me, you have very good knowledge and you have an advantage over candidates who passed from the first time. You studied the curriculum by heart more than once. This will give you an advantage. That the knowledge is very fixed in your mind, and this is something good for you. And passing in MRCOG, it's a matter of time. If you didn't pass this time, you will pass the next one. Anybody who started the route, who started the way for MRCOG, inshallah, will get MRCOG. So please feel confident, feel proud of yourself that you are walking in this very glorious way. So this course, which will start now, is a preparation for July exam. What if you are preparing for, let's say, January 2020 exam? No problem. You can take also this course, and I have some facilities for candidates preparing for later exams. Okay, let's have a look at the exam because some of us are preparing for the exam for the first time. They don't have enough information about the exam. The exam, inshallah, will be in 2nd of July. So we have February, March, April, May, June. We have 5 months. If we use them well, inshallah, they will be sufficient. To have Part 2 exam, you should have Part 1 MRCOG, and you should have sent what's called assessment of training. They need 4 years experience in gynecology, obstetrics, and family planning. So you have to send them to be able to book for the exam. Starting to send the assessment of training started already about 5 days ago, in 7th February. You can send this online on your account on the RCOG website. So if you didn't do it, please start to do it. Okay, so to join the exam, at first you have to send your assessment of training. Okay. 1 second. Okay. To be frank with you about my experience in Part 2 exam, I was reading slightly for 1 or 2 years, but the strong and condensed studying for the exam, it was the last 6 months. The very hard work was in the last 3 months before the exam. I passed Part 2, Alhamdulillah, from the first trial. Okay, so don't say to yourself, it will be my first trial. So no, don't do this. Work very hard, you may pass from the first time. It happened with many candidates, and you have to work for this. Passing in this exam needs some sacrifice. You will sacrifice with your time, you will sacrifice with some money, you will sacrifice that you will be away from your family, you will be separated that you are studying most of the time. So you will sacrifice, make it one sacrifice. Okay, so try to pass from one trial, inshallah. If you work for it, you can do it. So if you didn't send yet the assessment of training, so start sending assessment of training. Sending assessment of training will close at 21st of March. So you still have days to send it, about one month about. After this, you can start booking for the exam, inshallah. The exam will be held in UK and in international venues. Okay, there are multiple centers in UK and there are multiple overseas centers, Bangladesh, Egypt, Hong Kong, India. Okay, so you have to search for the nearest venue for you. The same exam will be applied in all centers in the same time. So choose the nearest one for you. Okay, what is the format of the exam? We passed part 1. Part 1 was completely single best answer. And we know well what is single best answer. Part 2, it's a mix of single best answer and what is called EMQ questions. The format of EMQ is different from single best answer. In EMQ questions, the question starts like this. For example, he is telling you about hypertensive disorders with pregnancy. Then he is giving you some options. Number A, atenolol. Number B, labetalol. Number C, admission. Number D, termination of pregnancy. Number E, deliver immediately. Number F, expectant management. Number D, frequent ultrasound serial scan. He is giving you 10 to 15 options. 10 to 15 options. Then he will give you the questions. Number 1, 30 years old patient, gravida 2 para 1, how many weeks of gestation, and he is giving you a scenario. Question number 2, 35 years old woman, para 1, 26 weeks, and so and so. Question number 3, so and so. So you will write that for question 1, I choose C, for example. For question 2, I choose A. For question 3, I choose D. So somehow it's more confusing than single best answer. To be frank, I say that there is nothing called EMQ. What I mean by this? I mean that if you are studying well hypertensive disorders with pregnancy, it doesn't matter if the question came as single best answer or as EMQ. It doesn't matter. If you studied the topic, you will solve any of them. It will be a problem for who didn't study this topic. That in single best answer, you have 4 or 5 options. So you have 20 or 25% chance of luck to solve the question, by luck. Here, the chance of luck is very difficult. You have 15 options. So you have 6% chance of luck. So it will be difficult if you didn't read the topic. It will be easy if you read the topic, whatever the format of the question is. So it doesn't matter. And I always tell to my friends that please don't look at the options. Read the question well, then think of it. Then prepare an answer in your mind. For example, the situation, it's a very critical situation of uncontrolled severe hypertension or severe preeclampsia with pregnancy. I need to terminate. Okay, so in my mind, I want to terminate. Terminate when? As soon as possible. Okay, now you can look at the options for the first time to see if termination is present. If the option containing termination is present, very good. This is your answer. Have another look at the options to confirm that there is no better option than termination. You find termination? Yes. So I am right. Alhamdulillah. I corrected the exam for myself. If you prepare an answer in your mind and you find that it's present in the options, excellent. You solved this question well. So please, never read the options before preparing an answer in your mind, except if it's not clear in the question what is he searching for. Then you can look at first at the options. The exam is made of 2 papers, each one 3 hours duration. So we have total 6 hours. In each paper, we have 50 single best answer and 50 EMQ. I always recommend to start with EMQ because it needs more concentration than single best answer. If you start single best answer before EMQ, you will be exhausted. And EMQs, they have about 60% of the marks. So they are more important than single best answer. So start EMQs with your fresh mind. Then you can solve single best answer. Between the 2 papers, there is about 1 hour break. Okay, and before the exam, I prepare a condensed revision course. In this course, I give more advices about what are you going to do in this 1 hour, which is very important. Neglecting this hour will make you perform badly in the second paper. So you have to prepare well, and you have to use well these 60 minutes. Very important. Okay, as you see, according to the RCOG site itself, EMQ 60% of the marks. Single best answer 40% of the marks. Although each paper contains 50 question, but the marks are more for EMQs. So don't lose EMQs. I am sorry to say, what make candidates lose the exam? EMQs, not single best answers. Because we didn't prepare well for them. We didn't learn how to solve EMQs. Okay, what happened in the previous courses? After that, I will explain what are the components of the course. Okay, I will talk about the last 3 courses. This was the result in the course preparing for July 2017 exam. These doctors, they passed in July 2017. They took my course for the first time. They passed, alhamdulillah, in the same exam, July 2017. Okay, I am sure that you know some of these heroes. I am sure of this. Okay, the next course was preparation for January 2018. This is January 2018. These doctors, they took the course and they passed in January 2018. They were about 83% of the doctors who joined the course and entered the exam. Okay, many of them already, they passed part 3 also. Some of them are already trainers now. Sure, you know one of them. Okay, and this was the next course, preparation for July 2018. Again, the result was 80% of doctors who joined the course, they passed the exam. Many of them, it was their first trial for the exam. They passed from the first trial, and I am sure you know some of them also. July 2018, so the next one was preparation for January 2019. Okay, I wish Allah gives them all success. We are still waiting for the result. Allah be with them. Okay, but during the previous 3 courses, the result was 80% or up to 83% of candidates passed the exam. And I wish Allah help them and give them success because they did very, very, very extreme hard working. Okay, you can't imagine what they did in the last 6 months. Okay, what is the format and what are the components of the course? The course, as we said, is preparing for July 2019 exam. The course is made of 3 parts. Number 1, the Longo course. The Longo course, okay, it's twice per week, each Tuesday and Friday. That's why our meeting today is Tuesday, because always it's Tuesday and Friday. It's twice per week. In each day of them, we meet online here on Zoom about 4 to 6 hours. Okay, usually we discuss 2 topics or more in each day of them. So Tuesday, Friday, until June. Then we finished the curriculum. Okay, in June, I start the second part of the course, which is the condensed revision course. In the condensed revision course, we meet 5 or 6 days. Each day of them, we meet 10 to 12 hours. Okay, in the last course, which was preparing for January exam, in the first day, we started 9:15, we finished 9:20. Of course, AM, PM. In these 5 or 6 days, okay, we revise all the curriculum, and there are some extra topics in the condensed revision course, and we solve many questions. Then, within the last 2 weeks before the exam, the third part of the course, at least 2 mock exams. I give you the exam, you solve it, and then we meet to discuss the answers. In this mock exam, you are trained how to manage your time. The exam is not only information testing, the exam is also time management. Many candidates, they studied very well, but they were not trained well how to do time management in the exam, and the exam finished before they complete all the questions. That's why we are trained to do time management in the exam. This is very important. So these are the 3 components of the course. One course containing 3 components, very important. All doctors who join the Longo course, they attend the condensed revision, and they attend the mock exams for free, for no extra fees. Okay, this is the coming course, inshallah. It's preparation for July 2019 exam. Okay, how many meetings are held? I will show you now how many meetings occurred in the last course. We meet twice per week, Friday and Tuesday. These are the timings to start according to different countries. UK, Egypt, Saudi Arabia, Emirates, Pakistan, India. Okay, I should add also Malaysia, I should add also Singapore, I should add also Somalia, I should add also Sudan. Okay, sorry if your country is not written here. Okay, in the last course, preparing for January exam, okay, we had 43 meetings. So Tuesday, Friday, Tuesday, Friday, Tuesday, Friday. We had 43 meetings. Sometimes, if there is lack of time and the time for the next exam is shorter than the time was available for January exam, because the previous exam was at the end of January. The coming exam at the beginning of July. That's why the time is shorter than the previous one. So sometimes I add third day. Usually it was Monday. So the basic each Tuesday and Friday. If I need to make it in a hurry, I want to add more days, I add lectures on Monday also. We discussed early pregnancy, diabetes, DKA, systemic lupus, ectopic pregnancy, maternal collapse, hypertensive disorders, small for gestational age, recurrent pregnancy loss, thrombocytopenia, preterm labor, cesarean section, labor care. Labor care was on 2 sessions, venous thromboembolism, twins, breech, bronchial asthma, anti-RBCs antibodies, thalassemia, sickle cell, breast cancer, psychiatric disorders with pregnancy, cardiac diseases, neurology, nerve injuries, induction of labor, GPS prophylaxis, headache, surgical incisions in gynecology and obstetrics, reduced fetal kicks, twins again, skin eruption with pregnancy, postpartum hemorrhage, TOG articles, renal disorders with pregnancy, intrauterine fetal death, governance, amniocentesis, morbidly adherent placenta, antepartum hemorrhage, infertility, contraception. It was on 3 days. Contraception, including all methods of contraception, emergency contraception, the UK medical eligibility criteria, everything. Because there are many guidelines about contraception. Urogynecology, laparoscopy, hysteroscopy, ovarian cyst, premenopausal and postmenopausal, hysteroscopy, menopause, hormone replacement therapy, sexual assault, heavy menstrual bleeding, complex social relationship and factors, endometrial cancer, obesity, osteoporosis, National Health Society cervical screening program, cancer cervix, pelvic organ prolapse, and the cancer cervix again, it was on 2 days. Female genital mutilation, hirsutism, premenstrual syndrome, and HRT, we said it, statistics on 2 days. Very important. Infections in gynecology and infections with pregnancy. Varicella, measles, HIV, hepatitis, everything. Zika virus, influenza. Vulval disease, very important. Maternal sepsis, ergonomics in laparoscopy. Ovarian cancer, thyroid disease with pregnancy, and thyroid disease with infertility. Antenatal care, endometriosis, inflammatory bowel disease, and also irritable bowel syndrome, endometrial hyperplasia. Okay, these are the topics discussed in the previous long course. In the revision, again, we discussed all topics and extra topics like enhanced recovery, basic surgical skills, sutures, needles, instruments, perforation. Okay, there are additional topics, additional topics in the condensed revision course. And who joins the exam before knows to how extent these topics are extremely important. So the course is 3 parts, long course, then condensed revision, then mock exams. Okay, what if I miss a meeting? And what if you didn't attend a meeting? You were absent at one day. No problem at all. After each scientific day, I upload the PowerPoint and the video on Google Drive. So you can watch the video and watch the PowerPoint anytime until the next exam. In this situation, July exam. So if you miss something, you didn't miss anything. You can watch it online. That's why you can study from it. Okay, so the material of the course is the material that you are going to study from. No need for any extra material. No need to buy books. No need to download guidelines. Okay, if you want to do, okay. But the material of the course is more than sufficient, inshallah. So nothing will be missed. If you didn't attend a lecture, you can watch it on Google Drive. This is private access for you and private access for the members. The material are undownloadable, so you can watch them online anytime until the July exam, inshallah. Okay, this is a screenshot from the previous Google Drive. From the last course, we had 43 scientific days. All were Tuesdays and Fridays. Okay, for example, this was day 32. We have here audio, video, and PowerPoint. Where this is the PowerPoint. Okay, by one click, you can watch the video and you can watch the PowerPoint. Okay, the audio is not a must. Sometimes I put the audio, sometimes not. The audio as separate file, but you can watch the video and you can study from the PowerPoint. Okay, thank you. I can allow mics now to be open. So if you have a question, I accept. In relation to a question about the fees, I forgot very important something. Okay, I made a discount in December, 20%. It was called the New Year discount. The good news for you, okay, the offer is still working for you. So you can still enjoy the discount which was in December. You still can use it, 20% discount. Okay, in relation to the fees, okay, I can take each one of you on private because it's according to if you attend previous courses with me or not, and I have some regulations for this. So you can discuss it with me in private. Okay, and doctors who joined my previous courses and want to attend the new courses, I always give them discount 50%. If you attend the previous course with me and you want to attend a new one, you can attend and I make discount 50%. Okay, and the questions are welcomed.